One of the questions I get asked are, do I ever turn down patients for plastic surgery? And the answer is absolutely. So when does that happen? There's a couple of different reasons why I might turn somebody down for plastic surgery. One simple answer is the risks outweigh the rewards. So most of the patients I see are in very, very good health, but not everybody. This is elective, it's cosmetic surgery, it's just trying to make you look better, feel better about yourself. So if you have some significant medical problems, a lot of times I don't feel it's worth it, and if the patient feels it's worth it and I still feel the risks outweigh the benefits, I'll explain to the patient I don't think it's worth taking the chance. So that definitely comes up, but not too often, because most of the people that come to my office are in very, very good health. When else might I turn down somebody for elective cosmetic surgery? It really comes down to the benefits not being realized. What do I mean by that? Everybody has expectations of what they can achieve with the procedure I'm doing, whether it's a filler or surgery or a laser treatment. And my job is to try to explain to the patient what a good average result will be. Not everybody's going to get the best one I've ever done. I'll certainly try my best on every patient, but everything, sometimes there's better results, sometimes there's less perfect results. So I try and convey what's a reasonably expectations to get from the surgery, and I really try and convey that to the patient. This is what you can expect. Nobody will be perfect. I do a lot of body contouring, smart lipo, and nobody is ever going to feel they're buff enough and perfect enough. So I really try and make that clear, because if I do a good job but you thought it'd be just a little bit better, you're not going to be happy with the results. So it's very important that the expectations be realistic with what I can achieve, and I try and convey that very well with my discussion with the patient. But they really have to look at themselves. The last category also doesn't come up too much, but it's really when the patient has an ulterior motive. What do I mean by that? Let me use an example, because that's really the best way to explain it. I had a woman see me many years ago, and she was here for a breast augmentation, and when I got talking to her, it was pretty clear that she had marital problems, and she was hoping by having larger breasts she would solve her marital problems. And I explained to her that I wouldn't operate on her because she didn't really want to change in her breast, she wanted to change in her marriage. And of course, just because I gave her better looking breasts, obviously would have no relationship to whether the marriage would change. So I explained to her that, she really had a different motive as to why she wanted the surgery. And there's a high likelihood that had I done a breast augmentation, she would not have been happy. Even if she got a great aesthetic result, she really wanted to change in her marriage, and of course this wouldn't have been achieved. So it's very important when I talk to the patient, I really try and get a sense of what they're looking for, what they hope I can do for them, and then I'll try and convey what I can do. And if I can't meet their expectations, I'd much rather they not proceed with the surgery.